Good afternoon, everybody, and thank you for joining today's briefing on COVID-19 in North Carolina. As of today, we have 16,507 confirmed cases, 507 people are in the hospital, and sadly, 615 deaths. North Carolina is making progress in our fight against COVID-19. We're currently in phase 1. It's a careful, cautious first step. It's important to remember that this virus is still a threat. We know that COVID-19 is circulating in our state, and we don't yet have a vaccine or a cure. A key factor in our state's readiness to move to phase 2 is testing. Statewide, we've doubled the number of tests in recent weeks, which is good, but we know we need to do a lot more. Testing has to be widely available at low cost or even free if we're going to keep people as safe as possible and reignite our economy, which we want to do so much. North Carolina has a number of testing sites across the state that are up and running to help meet this goal, and some of them are free to the person getting tested. Today I'm announcing that our North Carolina Department of Health and Human Services has identified these locations on its website to help people know where they can go and get tested. This information can be found at covid19.ncdhhs.gov. These include doctor's offices, local health clinics, hospitals, retail pharmacies, and other sites. We hope to add more locations every week. We're also deploying more protective gear to arm our frontline workers. For example, our emergency management is sending personal protective equipment to every one of the 3,800 long-term care facilities that we have in our state. As we work to meet testing goals, we're also evaluating whether North Carolina is succeeding in managing the spread of the virus and having enough hospital beds available. Today, Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, will provide an update on where we stand with our indicators. And I'll hand it over to her now. Dr. Cohen.
Thank you, Governor. And I'm grateful for your commitment to lead with science and data and being adaptable as we learn each day more and more about this virus. Your leadership and North Carolinians do what they do best, taking care of one another, has put us in the strongest position possible for phase 1. We didn't experience a peak in North Carolina, and that was no accident. We flattened the curve through our actions, and so far all those collective actions have prevented a peak. So let's recap the set of measures we are looking at to guide our decisions to ease restrictions. We continue to look at a combination of trends: COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, hospitalizations. Again, these were chosen based on public health data and White House guidance. We can't look at any one of these metrics in isolation. They all have limitations. In addition, we have to look at the data in the context of North Carolina. As I just mentioned, we aren't seeing a significant downward trajectory on most metrics, largely because we were successful in preventing a sharp peak in the first place. We look relatively stable on these metrics, as I'll go through, and that's a great sign. So first, this graph looks at people who come to the emergency department with COVID-like symptoms. This metric serves as an early detection mechanism. Looking here at the yellow line, it has continued to decline, and that's good news. On our next slide, we look at laboratory confirmed tests. We see a slight increase here. As you look at the blue dot all the way over on the far right of the graph, you can see that today was our highest day of new cases at 691 new cases today. But when you look at our 7-day rolling average, that yellow line, we look like we're beginning to level. We'll keep watching this. But remember, we've been doing a lot more testing, so the fact that we're seeing a slight increase in cases is expected. We've also been hearing a lot of questions on what's driving those positive cases. And when we look at those positive cases overall, less than a quarter of those cases are coming from congregate living settings. So we know this virus is in our communities. Next slide. Now, we want to put testing in context. The percentage of tests that are positive. I draw your attention again to the yellow line, and you can see it's going down and is now leveling. It's a good sign. So while we're seeing slightly more positive cases overall with the increase in testing, the percent positive continues to look good. Our last metric is day-over-day hospitalizations. This is the yellow line that shows hospitalizations continue to be overall stable. We have the capacity to meet increasing demand if it should become needed, if more people become seriously ill. So good news here. One bonus graph for today, again, because of a focus on our key capabilities, we've been focusing on making sure we're doing more testing. And as you can see in the yellow line of this graph, that trend has been going up. But we still have a lot more work to do to continue to increase testing. All right, so here's where we are today. Our surveillance data shows a decline, so green check. North Carolina's trajectory of lab-confirmed cases continues to slightly increase, so it still gets a red X like we had last week. But on the positive side, we aren't seeing any spikes. We're not seeing any rapid increases in the number of cases. And again, we're doing more testing, so we know this may not go downward for a bit. North Carolina's trajectory in percent tests returning positive is decreasing and starting to level, which is expected. This gets a green check. North Carolina's trajectory of hospitalizations is level. We have hospital capacity, so that's good. This also gets a green check. In terms of our other key capabilities, we continue to see great improvements. As I mentioned, we're doing twice as much testing per day than we were a few weeks ago, and that's good. And in our contact tracing work, it's really coming together. The Carolina Community Tracing Collaboratives already start hiring and training. And we have a distinct advantage in North Carolina with our very strong local public health system that's been doing this work for decades. Supply chains, except for gowns, continue to improve. So continued stability in this trend is a real positive for our state. But keeping our trend stable still depends on your actions. What you do to protect your loved ones and your neighbors. We still want you to stay home, and if you're sick, you should definitely be staying home. If you do leave your home, practice the 3 W's. Wear a face covering, wait 6 feet apart from other people, wash your hands often. Wear, wait, wash. With that, I'll turn it back to the governor. Thank you.
Thank you, Dr. Cohen. As you can see, our key indicators and trends are mostly stable. We're increasing our testing and tracing. And the supply chain of protective equipment has improved since this outbreak started, thanks in part to the many North Carolina-based companies and the hard work of our North Carolina Emergency Management and our Department of Health and Human Services. Phase 1, which still includes a modified stay-at-home order, is in place through Friday, May the 22nd. That's 1 week from tomorrow. Our COVID-19 decisions are guided by the data and science. We will use the time in this phase to keep a careful eye on the indicators before we're ready to announce the start of Phase 2. Now let me talk just a minute about faith. Our faith can sometimes mean even more to us during a time of crisis. I'm a church elder and was a Sunday school teacher for more than 20 years. I am so grateful for my church family. There's a real sense of belonging and a sense of community. When we physically gather together, shake hands, hug, sing, preach, take communion, we bond in our faith. I've really missed that, as have millions of North Carolinians. One fundamental tenet of faith is to care for and love one another. When doing these things in person together, sitting or standing indoors for more than 10 minutes, we greatly increase the chances of passing to each other a virus that can be deadly. Ask any of the congregations who've experienced outbreaks and deaths due to this virus. And I really appreciate the many houses of worship that have transitioned to doing outdoor or virtual services in order to keep their members safer. Regardless of executive orders, I would urge every congregation to pause and consider whether indoor services are the right thing to do right now for their members. We must care for and show love to one another. So, we need North Carolinians to keep doing what they know protects them from this pandemic. Stay at home when you can. Telework if possible. Practice the 3 W's if you're outside particularly. Wear a face covering. Wash your hands. Wait 6 feet apart from other people. And particularly the face covering indoors as well. I know it's difficult. People are making sacrifices on every front to help get this virus under control. I see those sacrifices and I appreciate them. We can only beat COVID-19 if we work together to do our part. Along with Dr. Cohen, with me today is our Commissioner of Prisons, Todd Ishii, our Emergency Management Director, Mike Sprayberry, and all of us will be available for questions. We have Karen Magoon and Brian, who are our sign language interpreters, and Brian Tipton. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. Now we will take questions from the media. And if you have a question for any of the 4 people who are here today, please identify yourself and your organization, and we'll take the first one.
Our first question is from Gary Robertson, Associated Press.
Hi, Governor. It's Gary Robertson with AP, and you've brought up already the discussion about faith, but you obviously know that there's been a lawsuit filed against you today claiming that your executive order is violating the U.S. Constitution, freedom of religion, freedom of assembly. Could you just discuss about why you believe the order that you've issued is lawful? And if you can say anything about the lawsuit itself.
Well, first, Gary, I haven't read the lawsuit, but the executive orders have been drawn carefully to recognize First Amendment protections. But let's look at the bottom line here. We don't want our churches to become hot spots for this virus. And as we think about this and as we move forward through all of these phases, the restrictions are going to gradually be lifted, and we're going to get to a point where there are going to be no restrictions, and we're going to have to, for ourselves, remember that we've got to still protect ourselves from the virus because the virus is going to be here. As I said earlier, when people are gathered together indoors and are closer to each other for more than 10 minutes, the virus has a significant chance to spread from one person to the next. And we've seen tragic consequences when that's the case. And so we hope that congregations across North Carolina will talk with their leaders and will make good decisions about what is right to look after each other. And Dr. Cohen, if you wanted to add something to that, she's got that. Okay, thank you. Next question, please.
Dawn Vaughn, News and Observer.
Hi, this is Dawn Vaughn with the NNO. Thanks for taking our questions. So Governor Cooper, you've mentioned before that restrictions could lift regionally. Will you give counties or groups of counties the ability to lift some restrictions like the calls for restaurant dining lists and personal care businesses? And what do you think about the idea of closing some streets to allow more outside dining areas like other states are looking at?
All of those issues are under discussion right now. We are getting a lot of input from local government officials who want more freedom to do their own thing in their own county. We're hearing a lot from restaurant owners and other businesses that are yet to operate and won't be able to operate until we get to phase 2. We are working with them to make sure that we have the right kind of restrictions in place when we move into phase 2. The decision hasn't been made yet whether it will be on May 22nd, but we're hoping that this will be a statewide move into phase 2 if our indicators show that we can. And if that's the case, we won't really need to worry as much about regional decisions being made. We're still open to that. We're looking at how things could be done regionally, but remembering that many people live in one county, work in another, shop in another, that the virus does not respect county lines, and so we have to be very careful about counties doing different things within the state. And we're going to continue to keep that on the table and to continue talking about it. Dr. Cohen, you got anything to add to that? Okay. Next question, please.
Kenny Beck, WXII.
Governor, thank you for taking my call. Kenny Beck, WXII 12 News. My question is for you and also for Dr. Cohen. The potential arrival of phase 2 also happens to coincide with the start of Memorial Day weekend. In any normal year, that would mean the start of swimming pool season and water park season throughout the state. And a lot of the big ones have already said they are so far behind because of all the restrictions that have been in place the last couple of months. There's no way that they can open on time, even if they were allowed to. My question is about some of the smaller pools, your neighborhood pools, community pools, HOA pools, things like that. Pools that are able to open on Memorial Day weekend. Should they? Is that safe?
Well, first, we'd have to decide whether we will enter into phase 2 on that Friday. If so, there will be a number of restrictions that would be eased, and I'll let Dr. Cohen talk about that just a little bit.
Hello, thanks for that question. And yes, if we move into phase 2, we are contemplating allowing pools to open. There will be some guidance on how to do that in the safest way possible in terms of restricting the number of people who will be in close contact, wiping down surfaces, and it's going to continue to be the same things that we've talked about around wearing a face covering, washing hands, and waiting 6 feet apart. But yes, we are contemplating that in phase 2, should the indicators continue to be stable and we move in that direction, that neighborhood pools would be able to open, but we would give them guidance on how to do that in the safest way possible. Thank you.
Thank you. Next question, please.
Hannah Jeffries, WITN.
Hello, thank you, Mr. Cooper. This is Governor Cooper. This is Hannah Jeffries with WITN. Thank you for taking my question. So the sheriff in Craven County has said he will not take action against churchgoers who are worshiping with 10 or more people for their church services. What is your response to that statement?
I would say that regardless of any executive order, I would want congregations to carefully consider what an indoor worship service might do to members of that congregation in spreading the virus. We know that churches can be hot spots for the virus. We've seen this in other parts of our country and other parts of the world. And the reason that's the case is that because people are together, standing or sitting for more than an hour. I hope that these congregations will make the right decisions. Law enforcement obviously should have discretion over laws that they're going to focus on or not. But the fact of the matter is, many law enforcement officers across this state have worked with people in their community to make sure they're taking the safest steps forward to protect themselves and everybody in that either that city or county. So we hope local law enforcement will continue working with people and continuing to take safe steps to keep them safe, and that includes churches and all of the other restrictions that we put in place. Thank you. Next question.
Travis Fain, WRAL.
Yeah, Travis Fain with WRAL. Thank you. I'd love to hear from Commissioner Ishii about why we have not yet stood up a mass testing program at every prison in the state, particularly for employees coming in and out of the prisons. But perhaps first, Governor, you or Dr. Cohen could address some changes in the IHME model out of Washington. They are saying that we're opening up too soon. Dr. Cohen, I know you said that we have not gotten to the other side of the infection curve yet because we did not have the high peak, but the numbers don't seem to be trending in a way that backs the moves we're making, at least not according to IHME, which says we're opening too soon.
Okay, that's a multi-part question. The first part of the question, Travis, I know our prison system is working on setting up testing for employees, and I'll let Commissioner Ishii talk about that, and then I'll let Dr. Cohen address the situation with the model out of Washington. Commissioner Ishii.
Thank you, Governor. Travis, thank you for your question about testing for our employees. And this afternoon, I'm pleased to share with you that we are going to release a comprehensive plan for testing for all prison staff, all staff of juvenile justice, and all staff of community corrections within the Department of Public Safety. It is a very comprehensive plan based on laboratory clinical testing opportunities throughout the state. We're very much looking forward to that, and please look for details later this afternoon in a release.
And hi, Travis. To address the issue related to the IHME model, the University of Washington model, that, you know, any one of these models has its own limitations, and that model in particular, the way they model is based on actions that were taken in Wuhan, China, and the kinds of restrictions that were put in place in China and then were lifted. As we look at what we did here in North Carolina in terms of stay-at-home orders versus what was happening in Wuhan, they weren't equivalent. And what is hard for them in their model, I believe, is understanding as we ease back, what does that really do in terms of changing? They have a bit more of an on-off switch for things that would impact viral spread, where we are trying to take a measured approach to easing the restrictions. And so we are still learning about what viral spread will look like here in North Carolina. Because they base it on Wuhan, obviously that is a very densely populated urban area. And so translating that to North Carolina is hard. But look, they're trying to model for the whole of the country, and I applaud them for doing that. But then we have to take into account the nuances here in North Carolina, looking in terms of our own trends, our own density, and then our own easing of restrictions. And the hard part about this is we don't have data to know precisely if we ease up on these kinds of things that are higher risk, what will it mean in terms of viral spread, which is why we have to go slow, which is why we have to keep looking at our trends as we make these changes to understand how is the virus spreading, because I believe none of these models truly take into account all of these nuances related to not just the geography and the nature of density in North Carolina, but also the nature of how we are doing the easing and putting on of restrictions and how the virus moves. So I hope that helps understand. And of course, we look at all types of models to help us inform our thinking, but it's really the numbers here in North Carolina that we are looking at that help us make the decisions. Are we as a state stable, and are we ready to move to phase 2? We know the virus is here with us. It will be with us until there is a vaccine. So the question is, how can we all work together to keep that virus level low? And it goes back to the 3 W's and some of these additional guidances that we'll give, whether it's to pools or to restaurants or others, to help protect all of us as we move through things. Thank you.
Thank you. Next question.
Michael Hyland, CBS 17.
Hi, Governor. This is Michael Hyland from CBS 17. We've been hearing from medical experts all along that it can take upwards of 2 to 3 weeks to see the results or the effects of changes that we make as a society reflected in the data when it comes to the spread of COVID-19. So I want to ask, how many more days of data do you all feel like you need to get an adequate impression of what the effects have been of phase 1? And regardless of when phase 2 begins, can you give us a better idea of what restrictions will be in place on businesses at that point so we can all have a better idea of what to expect? Thank you.
Yes, thank you. We like to look at data over a 14-day period. And the reason we picked the 7 indicators are because we know we need a lot of testing and tracing. We know that we need to keep a close eye on our level of hospitalizations and our percentage of positive tests. And we know we need to keep an eye out on people who are coming to the emergency room with COVID-like symptoms. So we have to look at averages over a 14-day period of time, and this is why we're waiting this long to make the decision to go into phase 2 on May 22nd. We said at the beginning of this that we would be making a decision on that within 2 to 3 weeks, depending on what the data looks like. And we have several more days of looking at the data to make that decision. And of course, Dr. Cohen just showed you where we are right now. In phase 2, some of the businesses that have been specifically closed or limited will be able to open at some capacity. You'll be looking at restaurants opening at some capacity. You'll be looking at other businesses that we have specifically closed, having special protections in place for customers. And we've outlined that in general in our phase 2 guidance that we put out at the beginning. But I know that we're working with a lot of those businesses along with health experts to determine the safest way for them to begin with limited openings. And I may let Dr. Cohen speak to that just 1 minute.
Great. Governor, you covered it well. I was going to say the COVID-19 task force has had subgroups that have been working on this. We have invited many of the businesses that are in question, whether it's the restaurants or the camp associations. We have been engaging with them constantly to try to understand how we can work together on this. We're charting new territory here. We want to make sure we're protecting public health, but allowing them to move forward as we do ease restrictions. They're all going to involve some combination of social distancing, wiping down of services, protecting employees and customers, and keeping everyone as safe as we move through. Individually, we will continue to really advocate for the 3 W's, the wearing of face coverings, washing of hands, waiting 6 feet apart, no matter what setting you are going in. And then lastly, I just layer on, even as we ease these restrictions, it is important for every person to assess their own risk. You may be over 65, or you may have multiple chronic conditions, or maybe you're fighting off cancer. I think those are the kinds of things you want to consider as you think about these activities. We are trying to set a floor for all of our state, but that doesn't mean each and every person, each and every family needs to think about their own risks as we go forward here. So we always want to do that in combination. We're going to give businesses guidelines on how to move forward, but then individuals and families need to understand their own risks and how to participate in some of these activities that can be of higher risk. Thank you.
Thank you, Dr. Cohen. Next question, please.
Haley Fixler, Fox 8.
Hey, Governor. This is Haley Fixler over at Fox 8. There's been a lot of focus on PPE and quick testing abilities for hospitals, but we've spoken with some local nursing homes who say there's a lack of resources and the waiting periods for the test is making controlling the outbreaks difficult. Is there going to be a new focus on helping these congregate living facilities?
Absolutely. We know that this is a place where we need significant testing, and we want to try to get people tested on a regular basis in all our long-term care facilities. We just have sent out, we've got about 3,800 of them. We just sent out or this week we're sending out personal protective equipment packages to all of our long-term care facilities because we know that they need that equipment to keep their patients and their staff safe, and they also need it to make sure that testing is administered. And when there is one person or two people who become infected in a long-term care facility, we have teams coming in to work together to test everyone in that facility and isolate people who are infected and making sure that we protect them as much as possible. Did you want to add to that, Dr. Cohen? Okay, thank you. Next question, please.
Our last question will be from Alma McCarty, WFMY.
Hi there, Governor. It's Alma McCarty with WFMY News 2. Thank you for taking my question. Just wanted to touch more on if you guys could talk about what is expected for wearing a face covering or a mask in public. It seems as though it's a little all over the place, at least from what I'm seeing. So I wanted to see if you believe this message is taking hold and what you are seeing personally.
I think it is important, particularly when people are indoors or even outdoors when they're around other people, to wear a face covering. The reason you are doing it mostly is to protect the people around you. And when we're not doing this press conference, we here at the Emergency Operations Center, we wear protective face coverings. And that's why we're doing the 3 W's. It's one of the 3 W's. And we want people to understand that you are doing it mostly to protect other people, your family, your friends, the people that you are shopping beside in a retail store. And so we're going to continue to push that guidance out and continue to urge people to do it. Also want to encourage small businesses, large businesses, in order to be able to get people to come back to your retail establishment, you're going to have to make sure they are confident in their safety. And that means making sure that your employees, particularly those who are customer facing, are wearing face coverings to show to them that you care about your customer. You want to make sure that it's safe. We want you to put up signs saying that you're disinfecting frequently. We want you to put markings on the floor to make sure people are social distancing. These are going to be important steps and probably becoming even more important as restrictions are eased through this process. And we're hoping that these kinds of things can become second nature to people, because it's going to be important for us to look out for each other, and wearing a face covering is one of the important ways to do that. Dr. Cohen? We thank you guys for tuning in with us today. We look forward to being back soon. Stay safe, everybody. Thank you.